activity is basically based on in healthcare, in micro health insurance, and developing community health leaders at the grassroots. The major change that we have brought about is brought down the healthcare costs for our members by providing with the micro health insurance programs, and the loans that they took earlier for healthcare expenditure was completely reduced. Okay, so when we did a post-insurance survey, what we found was about 97% of the people whom we had insured had not taken a loan for health care. Okay, that's a big reduction. And also the next thing is the health seeking behavior of the community members had changed, because earlier when they did not have our insurance, they will not go to the hospital when they fell sick. They waited till they get really very badly ill and then would go to the hospital because they were scared that they had to pay money. But with our health insurance card, what happened was the people started going into the hospital to seek out the doctor at the first incident of illness itself. They didn't wait for long. And the third major change was the nutritional intake. There was a lot of prevention programs that we had done. The health status of the community itself had changed because we encouraged them through our community health leadership training program. We encouraged them to the health leaders basically did a lot of programs in prevention of common illnesses, as well as help them access all the government programs for immunization for pregnant women and lactating mothers for 0 to 3 years. So they would go to the Anganwadi centers, they would go to the primary health centers, and would get the nutritional supplements. Okay, one of the measures for the micro health insurance, what we did was, because it was a pilot, the pilot was for 4 years. The renewal rate was for the 4 years. We had continuously monitored that. The claims ratio, the kind of illnesses, the trends of illnesses we have recorded. The third important thing is patient satisfaction and patient access, client access is the health-seeking behavior of the communities. Before they had insurance and when they started getting the insurance, when did they go to the health provider, the networked hospitals? How many people built soak pits within their families' homes? And the third thing is the type of loans that they had borrowed for a healthcare emergency.